name is Shavonda Joyner, and I am the liaison or program manager for the Family Resource Center here at the Children's Hospital. Our mission and purpose is to make sure that families have the things that they need that address those social drivers of health to improve health outcomes for children and families. So we want to hopefully eliminate or address chronic illness through making sure families have access to healthy food, making sure they have transportation when they need it to get to appointments and things like that. The partnership between VCUHealth and Feedmore started really small. It started in one clinic with less than 100 food boxes. And food boxes are provided by Feedmore with nutritious, shelf-stable foods that we can distribute to members of the community who are in need. Now we have grown into multiple clinics with over 500 boxes being distributed. Our greatest, thing that we would like to address is access. We know that there are food deserts. We know that there are places where people cannot get to grocery stores, and even if they do, how do you get all those groceries home on the bus? And all of these different barriers that families have. Access is the key here. So over time, we've learned things, right? We've learned that there was a gap when it came to our Spanish-speaking families. But now, the Hunger Helpline is in Spanish and English and many other languages. We have a Spanish-speaking community health worker here in the Children's Pavilion, and other Spanish-speaking community health workers throughout the health system who can help address that particular gap. We want to ensure equal access at all levels. This is something that we do without judgment because the need can be at the top and needs can be at the bottom. Equal access to food and to nutrition are the key points there. So we keep a record of the number of boxes distributed. We also keep a track of referrals. So each time a box is given, we refer them to Feedmore to connect the family or patient to longer-term resources in the community. On the Feedmore side, they're collecting data about whether or not the families actually make it to the pantry. So we did this referral, here are these pantries, wait, you're not going, what's getting in the way? And so then we kind of work with Feedmore to brainstorm and problem solve any particular gaps that come up. Transportation was a big one, and I explained to you what we did for that before, where families can call and we'll provide them with transportation. We definitely do a lot of storytelling. Anytime there's a leadership meeting or even with some of our donors, we make a point to talk about our partnership with Feedmore so that people can understand kind of the impact that it has. We also share stories from patients because we do have so many success stories and so many positive stories from our patients who have received food or received assistance from us. And we seek out partnerships depending on the needs of our patients. As new needs come up, we seek out new partners. And that's kind of how these things develop over time. Feedmore, there was a need, right? We see chronic illness, and we know that chronic illness is linked to nutrition and food. So what can we do, right, to bridge that gap? And so this partnership with Feedmore developed with food boxes. And those food boxes can be distributed, and those food boxes are nutritious, which is important. It's really exciting to have patients come back to us and tell those really meaningful stories. You expect, okay, I give someone a box of food, they can eat today, that's great. But then you have patients come back who are like, oh, I got connected to Feedmore and now I'm able to get food every week. We had one particular family who had a lot of needs. It was a single mother with a 2-year-old. One of those needs was food as well as housing and some other things. We were able to get her connected to Feedmore, and now she is able to feed her daughter nutritious food. Her daughter also has some medical conditions where her diet needs to be very specific. And so we were able to make sure that she was accommodating those for her daughter, which has improved her daughter's health. She brings her daughter back every time she has an appointment. It's like, hey, look at her, she's doing so good. So that's really exciting that now this little girl has access to the things that she needs to be healthier. Open, clear communication, I think, is something that has benefited all of our partnerships, including our partnership with Feedmore. Making sure everyone's needs are on the table, right? This is what we need, this is what you need. How can we collaborate to get both of our needs met and to serve the community? So I think those are really the really big important things, making sure you have that communication and that flexibility, because things do come up. Surprises happen, like, oh, I didn't realize that this would be the result of this change that we made, and now we have to pivot. And everyone has to be willing to pivot. Everyone involved in the process has to be open and have that flexibility. Collaboration can look many different types of ways, but I think it's a willingness to work together in ways that may be challenging, or on things that may be challenging. So that flexibility, like I said before, but also kind of a give and take, right? There are times when perhaps VCU may be shouldering a little bit more, and times when Feedmore may be shouldering a little bit more. But having that, again, flexibility and that willingness to kind of meet each other where they are, basically, much like people in any relationship. And in terms of collaborating with the community, again, working with the people who are doing the work. Whether that be Matchbox Mutual Aid or other organizations in the community that we can work with to better serve individuals in the community in need. What brings me joy each day doing this? Knowing that I'm having an impact, right? And being able to see that impact, because sometimes we're not able to see the impact that we have, and that can be disheartening. But I think that this work fuels me because I also see how important it is. As I see more and more needs and more individuals in the community who may be struggling, it motivates me to continue doing this work. It motivates me to find new ways to do this work, to find new solutions for folks, because I know it's out there, right? I know the ways to address the needs are out there. So how do we get it to the people? And that's kind of what drives me, is answering that question.